Okay, good evening, everyone. How are we doing today? My
Yep.
name is Stella, and I'm going to be having this interview with you all. I wanted to record it so that anytime anyone who wants to have a look at it, they can have the time to look at it. It's nice to meet everyone. I would like you all to introduce yourself. So I'm Stella. What is your name, please? Thank you.
I'm Janet Oluwashun Adeleke. Good
Okay.
evening, ma.
Good evening. Nice to meet you, Janet. Who else do we have here? Let's let's quickly
Comfort.
introduce ourselves.
Owolabi Comfort. Good evening, ma'am.
Sorry?
I'm Comfort. Owolabi Comfort. Comfort.
Comfort. Okay, nice to
Comfort.
meet you, Comfort. Nice to meet you, Comfort. And I believe we have every other person here with us today. Nice to meet everyone today. Okay. So it's all about interview. How do we prepare for an interview? And I believe many of us have an interview coming up soon, either this week, either next week. It's all about preparing for interview that we're going to be doing today. So I just want to confirm, are everyone here, are we all nurses or do we have any other profession here with us today? Or if you're not, say hi.
Hi. Hi.
Okay. All right, thank you. So I wanted to be an interactive section, It's boring. This one is just talking and talking and talking. And it's interview. One important thing we must know about interviews is that we must talk. There's no way you will keep quiet. Interviews are like you going to the market and you want to go and you are given a product. You want to go and sell this product. How will you sell that product? That's what interview is. Interview is all about selling yourself. You are the product you want to sell. So I will give you $1 million if you are able to market yourself that you are really worth that $1 million. And that's what interview is all about. Okay. So that's the interview we have today, going on today. So when you want to do for when you want to have an interview, the very first thing we need to know is that we need to be conscious about different factors related to yourself as an individual, factors related to the environment, factors related to the job role, and factors related to the interviewer. So those are the things you need to know when you are preparing for an interview. Now let's talk about factors related to the environment. When you want to start an interview, how do you prepare your background? Matters a lot. How do you prepare your environment? Matters a lot. Before I continue, please let everyone, if you know you're not talking, kindly mute yourself so that everyone could hear me clearly. Thank you very much. So factors related to the environment, things like your background. What is displaying on your background? Is your background so busy that in fact, the interviewer might even get distracted. Okay, if you have so many colors, they might be thinking, oh, this design, I want to try it at home. Oh, this one, I want to try. So they might not even listen to the thing that you are saying, like you are giving value, giving why you want to work with them, giving, oh, what happened if this happened? You're giving quality and they are busy looking at, busy being distracted from the back. So you would like a plain background. I would have normally what we used to do is we'll ask everyone, okay, open your background, let's have a look and see how your background looks like. But I will not do that for the sake of time. And we started a bit late. But having a plain background, like my background is quite plain. So a plain background we do for an interview, or even if it's not so plain, at least let it not be so busy. Let it be as simple as possible. Now, let's talk about noise. If you are preparing for an interview, you need to ensure that your environment is quiet. If you know you have your son, your daughter, you have your husband, you see that probably there's always noise in your house. You try to tell them within that period of time, okay, please, I'm having an interview. Can we ensure that at least for the next 1 hour, this house is quiet? If there is a way you can keep your children with your sisters, your brothers, your niece, your nephew, and for that 1 hour period, you can do that. Okay. If you know that no matter what you do, the noise will still be there. Let's say you have neighbors, and those type of neighbors are the ones that once you tell them, I have a busy schedule, that's when they will increase that noise. The best thing for you to do is to think, what other environment can I go that will be quiet? Places like probably your family house, your family friend's house, or maybe the church. The church is another good place to have interview. I remember then when I used to have my interview, I used to go to the church to have my interview because they might just be the most quiet place at that period of time. They might even be having party at the next house, and you cannot go and tell people that are having party to keep quiet. So you have to pick a place that is quiet, at least two, so that in case one did not work or one is looking like it's not going to work, you're going to solicit for the second one, which is very important. So ensuring a good background is very important. That's number one. Number two, when preparing for an interview, is to ensure that your network is good. Your network is good. I remember then, one particular of our clients then was preparing for an interview, and his network was so bad. It was so bad that even when the interviewer was like, okay, well, we'll try and see if we can reschedule for you, it was still so bad. So imagine I'm calling you, I cannot hear you clearly. You'll be feeling tired and frustrated. Let alone another person. And these interviewers have thousands of people that are waiting. In fact, let me tell you, recently we opened a vacancy in our company, and we have over 500 people that were applying for that job role. Now, this is within Nigeria. Can you imagine how international job is? Because you're having people from different parts of the world applying for this job. And again, your red listing did not even favor you. So why should you give chances for anything to happen? So you need to ensure that it's a place. If you know that MTN is not working in your environment, try Etisalat. If you know Etisalat is not working, try I've forgotten the other ones. You try them. You try them to see if they can work. If it's for you to get MiFi, if it's for you to get anything broadband, just to ensure that you have good network at that time, you try it. If you know that going to another environment, maybe where you are, your network is not good, maybe a deep village, your network is not good. You know that if you go to, if you go to your family house, or if you go to another place, maybe in a city side, the network is better and it's quiet, you better go there to ensure that you have good network. At least that will last you for an hour. Please charge your phone. Okay, please charge your phone. Let's not take the risk of saying, oh, okay, well, I will just manage 3 bar or manage 10 bar. No, that's not how to get prepared. As a nurse, normally, we need to be prepared for anything. So preparing ahead of time is one quality of nurses that we need to have. So we need to ensure that we are prepared like that, okay? That's in terms of the environment. Now we are done with the environment. I'm just giving general tips here too. We'll still get to the call one where I'll be asking you questions, you'll be giving me answers. So what we are doing now is how we are preparing the ground before we start watering it. Okay? Or how we are watering the ground before we start putting the seeds to plant it. So let's go to the second option. Can you mute yourself? Please mute yourself. Thank you. So let's go to the second option. Well, sorry, not option. Let's go to the second point, which is your factors related to yourself. Factors related to yourself, like your confidence. You need to ensure that when you are having an interview, I used to tell people, do not see the interviewer like your boss. Do not see the interviewer like your at times in your environment, your boss can be so harsh that you are so scared of your boss. Don't see your interviewer like that. See your interviewer like your close pal, people that you are relating to, people that you are interacting with, people that you can share this. Let your interview be more like a discussion. Because by the time you are seeing your interviewer like that, you will know that this person is just an human being like you and is just there doing their job, asking questions to you. So all you have to do is to respond to them. All you have to do is to give them the reply. Because if you are scared, you understand, if you are scared, it might be very, very difficult for you to get an answer. It's very difficult for you to create an answer when they are asking you questions. So it's very important that you are very, like, you've comported yourself. It's very, very important that you see them as your friends when you are having an interview. Before you have interview, you ensure that you are prepared. You know what to expect. You know how to prepare yourself. You know, now we're coming to the job description. You know the type of questions that they will ask you. You must have gone through YouTube. You must have gone through probably you browsed online to ask for possible questions that they could ask. You must have gone to research on the hospital, at least to know maybe the recent things that happened, or to know their location, or their trust. If it's an NHS trust, the trust value, you understand, and this trust vision or the goal. If it's hospital, what's their goal? What's their vision? How do you think you can achieve it? Then for the job role, you need to understand what the job role and the job description is all about. You need to also understand what the person specification is all about. I need to tell people that interview is like, it's like an expo. Why do I call it an expo? This is because they've told you what they want. They told you that what they want is, they want someone that is this. They want somebody that is that. They want someone that is creative. They want someone that is innovative. They want someone that is a team player. What is your job role? This is what you would do in the job. But while you are doing that job, the type of person we want to do that job is a person that is this. All you are doing is to come to tell them, okay, you want someone that is a team player. I am a team player. You want someone that is into that is creative. I am creative. And you will give example. You want someone that is innovative. I am innovative. You want someone that has experience or probably has worked in this way and have idea of what the job role is as a nurse. I have that. So that's what you're coming to tell them in an interview, and that's factors related to the job. So you need to be prepared, okay? Also, I always tell people, another tip is smile. Your presentation matters a lot. Some people get tense. So, like for probably me, if I'm having an interview, I tend to smile a lot. Why? Because when you smile, it's kind of calms your nerve and make you prepared for the next step. And then you don't just, when they ask an interview, you don't just start rushing to give an answer. Even if it's 1 second you give yourself, or 2 seconds, so take a break, reflect on what they ask you and respond. It gives you that opportunity to prepare and organize your words very well. Not, can you tell me about what happened to this? No. All right, thank you very much for this question. Well, just like that, you start that way. You go in. You don't need to form voice. You don't need to form phone. You don't need to form anything. Normally, we are Nigerians. We have our own, or Africans, depends on where you're from here. We have our own accents. Everybody have accents. So there's no point of forming. If it's 1-1, you know how to say your word. Say your word 1-1. At times, when you form self, they cannot hear what you are saying. But when you adjust yourself, you speak with your own accent that you have. You just give the response to what they are asking you. It makes things easier when you are having an interview. Okay, that's another tip when you're having an interview. So now let's go to possible questions that they normally ask you. One important question they ask in an interview is, tell me about yourself. Tell me about yourself. And for you to give a reply to tell me about yourself, you need to ensure that you have prepared from one step to another to give that reply. You don't just say, okay, my name is this, like you just jump from one place to another, one place to another. No, you go systematically to give the answer. Everybody have a different way they give that answer. Do you understand? Everybody have different ways in which they give the answers. But one way I used to recommend is you can start from talking about when you finish from the school. You can continue to your work history, where you have worked and the kind of people you have seen. Okay. Then you can also go from there to talk about you can also go from there to talk about your qualities, and then how you can what you are bringing to them, what you are bringing to the table. You can go further to talk about them. But make sure that while you are talking about this, you don't give unnecessary lengthy answers. Remember, make sure you don't give unnecessary lengthy answers when you're talking about all this. Make sure that the answers that you are giving are something that you have prepared ahead of time. If you want to talk about qualities, it's not a must you must talk about all the qualities. You can just pick 2 to highlight on. If you want to talk about what you can bring to them, maybe one of their values, you can just pick 1 to highlight on. So you must not go and talk about everything. So when we've known about how to talk about ourselves, or tell me about yourself, I'm going to start asking you questions now. So number 1 question, which I'm going to start from Ifoma. Ifoma, are you here with us? No, Ifoma, are you here? I can see you've unmuted yourself. Okay, so if I can't hear you, can I have Nurse Geraldine? Are you here with us today? Nurse Geraldine, are you here with us today? Oh, please, can you all hear me? Because someone just said on the comment section that she can't hear me. That's Ifoma. Can you all hear me?
I can hear you.
Yes, I can hear you too.
Okay, all right, thank you. So now, thank God, I just want to catch everybody now. So, Nurse Peace, you can hear me?
Yes, I can.
Good. And when is your birthday?
On 25th.
25th, and that's how many days from now?
2.
2 days, good. So now, can you tell us? And please, everybody be listening, because I'm going to pick one person to score her on how she performed. So can you tell us about yourself?
Okay, thank you very much for that question. My name is Peace Ufoma Otiara. I graduated from Delta State University in Delta State, Nigeria, graduating student. The year 2010, I graduated with a CGPA of 3.8, normally classified as second class upper. And I proceeded to completing my internship in the Federal Medical Center, Asaba in Delta State. Upon completion of my internship, I proceeded to serve my nation, Nigeria, as a youth corper for a period of 1 year. After which, being a person who is keen about personal development, I decided to take up a postgraduate program in midwifery, which I completed in 2020, and I became a registered midwife. And then I got a job with the Federal Medical Center, where I finished my internship and youth service as well. And I worked in the acute care setting for 2 years, after which I got employed by the Ministry of Health in Saudi Arabia, of which I relocated from Nigeria to Saudi Arabia, where I'm currently working. And for now, I'm working in the emergency department in the Bukhara General Hospital in Saudi Arabia. I don't know if that's all. Thank you.
Okay, thank you very much.
I don't know what to add again.
Okay. All right, so let me look for what I have here. I have John Paul Aluba, or Mr. John Paul Aluba. I don't know if the person is a male or a female, but could you unmute yourself?
Hi, good evening.
Good evening. So you've heard her. So what will you score her on that? And what's your correction?
I'll start by thanking you for taking out your time to do this. Yeah, and to inform us as well. She has done well. The maid personality was quite differential.
Okay.
And the pace at which she spoke uh, nice at the same time. Though she stops, this is not something which I don't think it's supposed to stop at that point, but then I think it is allowed, if I'm correct, then it's well.
Okay. Thank you very much. You can mute yourself now.
Sorry about that.
Thank you very much. So can we have Nurse Janet Oluwashimu? Nurse Janet Oluwashimu. If Nurse Janet is not here, can we have Nurse Clinton? Please, can someone mute herself? Ifeoma, please, can you mute yourself?
Hello, good evening.
Good evening. Please, could you correct the lady that just spoke? And also, once you've corrected, I want you to tell us about yourself.
Okay. Like what you said earlier, I think that about the interview, it's more of you selling yourself properly. So first of all, you make good proper introduction of yourself. You know. Okay. First of all, you thank your interviewer, like saying hello. It's an honor, a privilege to be in your midst today, having been called up for this interview. And then before you now kick in from introducing your name, then gradually you step into your educational background, your career. It's more of selling yourself, your skills, things that you think you can offer to the organization and the reason why you really want to work for them. So as you are talking, you have to make your words brief, concise, and at the same time trying to give the accurate points and things needed while you are talking. Then you tend to be more real, you smile, and then tend to be more real, and then you just try to speak in such a way that aligns well with your tune, in order for you to get a bit relaxed and more comfortable when you're talking. So I think that's it.
So can you tell us about yourself now?
Okay. Okay. Okay, let me start. It's an honor to be in your midst today for this interview. So I'll first of all start by, my name is Nwokolo Clinton Kosochukwu. I'm a registered nurse, having graduated in the year 2020 from the College of Nursing St. Charles Borromeo. I was the course rep of my school from the association of the class to my graduating year, and I was also among the best graduating students in my school. So after my educational background, I ventured into my practice immediately. So, but during my school days, basically, I've been working in the accident and emergency unit, which have given me that zeal and motivation and also passion to love the accident and emergency unit. So my first job role was working in an accident and emergency unit here in, having been mentored under senior colleagues, emergency doctors, senior nursing colleagues, and having attended different seminars. I'm able to work in a okay. After saying my skills and then I would then say working with the NHS has always been my dream, and joining your trust will actually be a good thing that I would like to. And me, I'm a caring nurse, compassionate nurse, and a nurse who prioritizes patients and promotes health. So I'm a dedicated nurse, and I think I'll be able to venture well and also give my best and all in working with your trust.
Okay, thank you very much, Clayton, for that. Well, you were trying to go systematically, but I don't think you've practiced enough to know how to organize yourself and how to give an answer. So it's one thing for you to know how to go about giving an answer. It's another thing for you to actually give that answer. And at times, you will just stay and you will say, okay, this is how I will go about it in your head. But there's a difference between saying something in your head and saying it out. It's only when you have said the thing out that you will know, okay, this was where I made a mistake and this is how I can correct it. Okay? So now, when you say tell me about yourself, you are trying to go sequentially, which is true and which is correct and which is fine. And what's her name? Miss what's her name? The first lady that spoke to us. That lady, she actually went, like she tried. I love the way she was, her confidence and everything. Yes, she did well, but you don't just stop there once you've talked about where you are. You're supposed to go further to talk about these qualities and then what you bring to the table. Just like how when you say what you bring to the table, probably you are talking about how your values and how you talk about one or two of their values and kind of keep it in on what you have done and how you can implement it, how you are doing it currently, and how you can implement it if you are given an opportunity to come to work in the organization. That is what Mr. Clayton was about to do, but he has not really organized it. So when you guys want to go for an interview or you want to prepare, just try to ensure that you have what you want to talk about. You know that, okay, I've talked about where I am, I've talked about where I'm working. How many values am I going to talk about? Maybe two, so that I will not talk too much. And then also, what skills can I say I'm bringing? Comparing it with their values, you can put that in and then you bring it. Now, when you're talking about your qualities, you don't just say, I am confident, I am compassionate, I am dedicated. Everybody says that. There's no point on saying that. If you want to say, I am confident, I am compassionate, you must use the principle of saying it, giving an example of how you have done it, so that they will know that, yes, you are really compassionate. If you want to say, I am dedicated, you can always say, okay, I'm someone that is dedicated. Whenever I come to work, I try to ensure that I go through what I'm doing diligently. I'm someone that always likes to have a plan on priority and ensure that I focus based on priority. I also know how to go about delegation. So you can give an example. It does not mean you have to talk so much, but you need to show and give an example on how you have done this. I'm someone that is caring. Whenever I'm giving care, I always consider, what if I was the one on that bed? How would I want people to care for me? And because of it, I go further to ensure that I give quality care to my patients. That's just an example. So this is how you give that, okay, I'm someone that is a good team player. As a nurse, we always interact with lots of people. We interact with the physiotherapist, we interact with the healthcare assistant, and being a team player is a key role and a key skill nurses have, because without this, there could be conflict that arises within the organization. And so I need to ensure that I have this skill. And so I have it, and I've helped my patients with this good team playing skill that I have. Just simple examples that you give, and it's very, very important. And they can really make a difference between you and another person that just come and states that they are this and that's all. But remember, while you are giving an example, ensure that it is not lengthy. So that's it about the first question. So the second question is, when you want to talk about it, the next question they'll ask you is about your role. Now, you've told them about yourself. They've known who you are. Now they want to understand, do you know what is the job role that you are coming for? You know you are coming for an interview, but do you understand what that job role is? So I'll be passing that question to Nurse Omowumi, sorry if I didn't pronounce your name well. Can you tell us the roles and responsibility of a nurse and how you have partaked in that role? Can you tell us, is she here? Can she hear us? Can you hear us? If she can't hear us, can another person give the answer? Can you tell us the responsibility of a nurse and how you have partaked in that role? You guys like me to call people name. Okay. Nurse Jeanette, can you tell us the roles and responsibility of a nurse and how you've partaked in that role? People will not answer. I'll move to the next question. No. Nobody is answering. Nurse Peace, please, can you tell us the role and responsibility of a nurse and how you have moved and how you have participated in the role?
Okay, thank you very much for that question. one of the essential role of a nurse is, sorry. Oh my God. Okay, let me come again. Thank you so much for that. Thank you very much for that question. One of the essential role of a nurse include assessing my patients. While assessing my patients, I have to do that in order to be able to give holistic care. And I have done that on several occasions. Whenever I report to my duty post, I do my best to gather patient information, relevant information, both from medical records, from nursing records also. And I'll be able to give holistic assessment of my patients and make necessary planning, make planning for the patient for that day, using the nursing process by implementing my nursing care plan and setting up realistic and achievable goals, which I normally review and with the patient, and with the consent of the patient, I can also involve the relative of the patient so that such goals can be achieved. I don't know, should I say more than one? That is the only one I can remember for now.
Let me ask you, what are the roles of a nurse and the responsibility of a nurse? The duty of a nurse is to care for a patient. And as a nurse, I always ensure that I do that. When offering care to my patients, one of our role is to ensure that we advocate for our patient and advocate for our family. So when I'm trying to ensure that I achieve this, I try to speak and communicate with my patients to understand how I can best attend to their needs, to understand how I can best provide for them. Another role of a nurse is assessment, your ability to improve your assessment skills, your ability to prioritize, and you give one or two examples. So when you want to say, what is the roles and responsibility of a nurse? You can use the 6 C's of nursing, although these are qualities, but you can bring it in on how you have participated as a nurse. So one of the key qualities of nurses are: 1, being caring, being compassionate, being confident, being competent. You can use the 6 C's of nursing. Now, if you know you don't want to use the 6 C's of nursing, you can use assessment, planning, implementation, and evaluation. Those are ways to give an answer to those questions when they ask you, can you tell me about the roles and responsibility of a nurse and how you have partaken in it? Is that okay? Is that okay?
Yes.
All right, thank you very
Yes.
much. Do you
Yes,
have a
okay.
question in regards to that? Do you have a question in regards to that? Do you have any question? Okay, no. So Nurse John Paul, I've given an answer to that question, but I want you to give me your own answer. What are the roles and responsibility of a nurse, and how have you partaken in it, Nurse John Paul? I'll keep going. Okay, thank you for answering.
Yeah, even though you've given us the expo, but then but then I think we can still do the
It's one thing to
regular
give an
brush up.
expo. It's another thing for you to voice it out. I want to hear you guys voice it out so that I will
Yeah.
know, yes, we are working together.
Okay. Yeah. I'll start by saying as nurses are important let me say member of the healthcare team due to their various roles and responsibilities, which includes frequent patient assessments, in which I personally carries out this on a daily basis from duty resumption and to the end of my duty every day in order to dictate, correct, and then communicate effectively when necessary. During the course of, and then from there, I move to planning on a daily basis. I plan for each patient according to their needs. Yeah. So from there, I will cite some examples where I've planned for, I've assessed a patient, and then I detected some needs where I made a plan and then implement the plan. And then I can give some outcome to that will maybe probably uh, take care of the implementation and outcome part of it. I'll just look for an example and then make that. Then I can also digress a little bit to maybe I'm a good communicator. I communicate effectively. I ensure that uh, I pay attention to my patients, or I pay attention to details. I listen to their concerns, their worries, and so on.
Okay, all right. Thank you very much for that. So you've actually given a even much better detailed answer that I give. So when you ask you about roles and responsibility of a nurse, it's what you do normally, it's what you do on a daily basis. You don't need to go about talking, oh, I do wound dressing, oh, I do this, oh, I give injection, no, you don't need to do all that. We can go systematically. What do nurses do? Assessments. Before you give injection, you assess. Before you do also, all those things are already involved in assessment, in plan, implementation. And then after you've implemented, you always still go back to evaluate and to go and check. Oh, I gave a pain medication. Was it effective? Those are evaluating. How was it? Do I need to give another one? Is it a thing of positioning? So these are things we need to know when we are giving an example. Okay, what are the qualities of nurses? The 6 C's of nursing. We know that. We don't know that, please go and read it up. Or the 4 P's of nursing, what nurses are basically called, what nurses do. The prioritize the patient, promote professionalism and all that. Preserve safety. Very, very important when you are practicing as a nurse. So we can use all that to answer our question. And Nurse Pat, please, could you mute yourself? I'm begging you. Thank you very much. So that's how to give an answer when they ask you this question. Now they could ask you a question of, okay, can you tell us, okay, why do you want to work for the NHS? Now, before I ask you on this question, I will give you a tip on how to answer this question. First, you have to talk about factors related to the NHS and factors related to yourself. Why you think you deserve to work for the NHS? Why you think you want to work for the NHS? What is it about the NHS that you want to work for? You need to think about it. You don't need to say about everything, but you can think about 3. What are the key principles? What does the NHS stand for? The NHS stands for the 7 pillars, which are what? Infection and control, teaching and education, patient and family involvement, clinical audits, research. They are up to 7. You understand? That's 7 clinical governance the NHS stands for. Now, when you know the NHS stands for the 7 clinical governance, you also need to know that, okay, so the NHS also is a multicultural environment. The NHS is a multicultural sector. So once you understand what the NHS is, you can then relate it to yourself and say why you want to work for the NHS. So I throw the question back to you guys now. Why do you want to work for the NHS? You guys want me to select again? Nurse Janet, I've called you several times today. You've not even responded. So please, can you answer the question? Why do you want to work for the NHS? Or why do you want to work for the company that you are interested in working for? Let's use that example. I've asked Nurse Janet questions so many times today. She's not responding. Okay, Nurse Pristine, please, can you unmute yourself if you are here and respond to the question?
Hello, good evening.
Good evening. Thank you very much for responding.
Yeah, the question, although I had something in mind before, I prepared for that question before, I didn't think of the area of 7 clinical governance like you
Okay,
just
you don't need
mentioned.
to use my own. Give your own answer.
Okay, so
Thank
thank you for this question. Regarding why I would like to work with this trust, I did some due diligence about the trust and I got to know about their values, which includes respect, excellence, and compassion. And these values, they very much resonate with my personality. And I would really love to work in an environment where everyone is treated with utmost respect. Like I said before, this respect is something I very much take into consideration in my dealings with everybody, be it my colleagues or my patients. Also, I want to work in an environment where I have like-minded professionals who are very much committed to deliver excellence and compassion to their patients and colleagues at large. Thank you.
All right. Thank you very much for that. So that answers to that question fits more with when they ask you, why do you want to work for our trust? When they ask you why you want to work for the trust, the way you went about your answer was perfect. Okay, perfect, perfecto, well done. That's Preston. Because I remember when I went for an interview, they asked me that question: why do you want to work for us? Why do you want to work for the trust? And you telling them that, oh, I've done a research, I know what the values is, I know what the core values are. That's also good, a very good one. And also, if you find out that they have a campaign ongoing, let's say you've checked that CQC rating. CQC is like an organization that comes to rate each hospital and know if they are up to standard. And you've checked their CQC rating, and with their CQC rating, it's found that they are trying to improve on their infection and control ability. You say that you're someone that will want to continue in this trend and want to also follow in the growth to achieve the goal of their organization in achieving the standard of infection and control. So that's one way also on going about it, but it's just that one is just Jara adding it to what you've already said. So the way you went about this answer, it's very good. So well done for that. But when they ask you why you want to work for the NHS, you adding that is also good, but also understanding the 7 clinical governance, because the NHS is broad. So it's not just only about your trust per se, it's also about the big trust, like big NHS. So NHS, and it's actually just related. So kindness, respect, like you said in your organization, then the NHS also have their own core value, which they stand on, which is the 7 clinical governance. So if you can just pick 2 or 3, I just like the way you picked 1 or 2 to give that answer. So if you can just pick 2 or 3 and give the answer as well too, that would be very, very nice. But it's a different question. Why you want to work for us? I love the way you went about it. Well done. And so anybody that's listening to that she's giving that answer already, so I don't need to ask that question. But why you want to work for the NHS? If you could use the clinical governance, you just need 2 or 3 and you're fine with it. You can even talk about why it's even a multicultural, and you've had experience working with people from different tribes, different, and how you want to also improve yourself to know how to give care in a larger capacity, what you're already doing within your organization. So doing that is also very good. So well done. Thank you again for that. So next question I would like to ask other people is, I've talked about knowing your 4 C's, knowing your 6 C's of nursing, your 4 P's of nursing. So next question I would like to ask you is, when they ask you, what are your strengths and your weakness? What are your strengths and your weakness? Now, I would like Nurse Geraldine. Are you here? Is Nurse Geraldine here? If Nurse Geraldine is not here, is Nurse Omowumi here? If Nurse Omowumi is not here, is Nurse Promise here? Chinenye?
Yes, I'm here.
Thank you very, very much for responding. So I want to ask you a question. So could you kindly tell us about your weakness and how you have worked in overcoming this? Thank you.
All right. Thank you for the question. For my weakness, it's like I pay too much attention to details, and it makes me spend a lot of time trying to accomplish a particular task. So, but recently I've been working on it to find a balance between um, achieving a task, between paying attention to details and then the efficiency. And also, I've been trying to learn how to delegate tasks to other people because it will equally help in achieving a particular task in a short distance instead of wasting much time on it. Thank you.
Well done for that. That's a good answer. Thank you so much, Nurse Promise. Because giving that kind of answer, it's a safe. So when they ask this kind of question, you need to play. It's like you need to look for the safe bets. You know, as a nurse, you give medication. So you cannot say your key responsibility as nurses is what you have weakness in. That's no good. You cannot say your key your key roles, giving medication, doing some what I call it, communication advocacy is when you are having issue with no. But a safe bet like what she used, she pays attention to details too much. You understand? Something like I'm too dedicated. Something like, oh, I have a little bit of issue with my dedication. I'm all about work. So at times it might affect me balancing it at home. But I'm working on these days to ensure that I have a work-life balance. It's going to be a weakness, but it's also going to be a strength. The kind of weakness that is a strength, that's what they need for this kind of answer. And I like the way she gave the answer. I also like the fact that she said she's working on it and is now practicing delegation. That's a very key word. If you had not mentioned it, I was going to mention it. I've already written it down on my paper. Practicing delegation. Most nurses want to just carry all the work on their head. You need to practice delegation. So your ability for you to even mention the fact that I'm now working on this attention to details. Why I'm trying to overcome it, I'm still not reducing my attention to details because they still like the fact that you are still attentive to details. But I've tried to ensure that while I'm attentive, I'm delegating stuff and ensuring that I follow up to ensure that task is being achieved. So well done. And I believe every other person has heard our answer, and that's a practical answer to give. Thank you very much for that. So now, next question they'll ask you is medication calculation. So you need to understand minor drug calculation in an interview. Some interview will even give you questions like, okay, you are being prescribed to administer 1,000 mils of normal saline. You're supposed to administer it in 8 hours. How many mils per hour will you give? Can somebody give me an answer to that? That answer should be echoing. You are supposed to give 1,000 mils of normal saline in 8 hours. How many mils should you give per hour? Are we calculating it? I'll give 1 minute to calculate, or 1 second. I'm thinking who I'm going to call to give this answer.
125 mils.
Thank you, Nurse Janet. Finally, you just know it's your name.
I'm sorry, I have a baby.
I was targeting your name. Thank you very much.
I'm also in the kitchen. That's why. I'm sorry.
Okay. No problem. No problem. Thank you for at least responding. 125 mils per hour. That is the right answer. They could also ask you, these are simple questions whereby they prescribe for you to give 5 milligrams to a patient, and what you have is 10 milligram tablet. How many will you give? So in this case, you'll probably be giving half of the medication because you are giving half of it. So that's probably what you'll be doing in this case, okay? Because it's 5 milligram and they ask you to give, it's 5 milligram, you only have 10. So you might just some medication that allows you to break it into two, not all. So the ones that allow you to break it into, you will see it saying this sign, you will see the sign of division there already. But the ones that don't allow you to break into two, like capsule, like some medication that you can see is not, once it's not divided, you cannot break it into two. That kind of medication, you have to order for the dose. But this question, they're asking you drug calculation. They're not asking you whether you administer it or not. So you need to know the answer. That's about medication calculation. Still under medication, we're going to be talking about medication error. So number one question, you administered a medication error. You administered a medication and you observed that there was an error in the administration. The patient is already having the medication. What will you do? Nurse P, seems like you are ready to give an answer to that. Ah, she has run an off herself. Oh yeah, Nurse Clinton, over to you. She has thrown the baton to you. What will you do?
So what's your question again?
So my question is, you're administering the medication to a patient, right? You are
Yes.
currently administering and you observed that you're administering the wrong medication. What will you do?
All right. What I would do, I think that's what we call I think zeal of candor. So I don't really know. But what I would do is that a lot of candor. So what I would do is that I'll explain to the patient what happened. I'll do proper documentation and then inform maybe my nurse manager and then inform the doctor that is on duty. And then I think that's what I would do.
We need that answer systematically. What do you do?
Okay.
The medication is ongoing and it's the wrong medication.
All right. No. Okay, what I'll do first is that I'll stop giving the medication at that moment.
Correct.
And then I'll explain to the patient that the medication I'm actually giving her is not the right medication. But I'll reassure her that she doesn't need to worry. That's the first thing I will do first, since if it's not that harmful to her. And then I will call in my nurse manager on duty or my senior colleague on duty. I will then tell her what has happened. I'll then make my proper documentation. I'll document what has happened, and at the same time, I'll then escalate to the doctor for what needs to do.
Okay, that's fine. Okay, someone wants to give the response. Thank you very much, Nurse Clayton.
Okay,
I just want to
it's not like
Sorry.
Please.
I want to say something.
Okay, go on.
Okay, after when you must have stopped the medication, then you do a holistic assessment.
Correct.
Then check the vital signs to ensure that the patient is not in any danger.
Good. I was going to mention that. Thank you for mentioning that.
And then explaining to the patient, you also apologize.
Yes, correct. And also, if the patient permits you need to inform their family, especially if patient that lacks mental capacity. You need to inform their next of kin or their family what had taken place. You also need to incident reports. Apart from documenting your notes, you need to incident report it that an incident has happened. So that's the answer to that question. So you're having a medication round ongoing, and a colleague of yours, you observe that that colleague has made a medication error. What will you do? What will you do?
Okay, can I give it a try?
Yes, go on.
Okay, so if I observe a colleague make a medication error, first of all, I'll bring it to her notice, him or her, I'll bring it to the person's notice, and then I will write the OVR, that is the occurrence variance report, and then I will also encourage her to escalate to the head nurse, the person we are reporting to, and probably the doctor also, for the doctor to be aware we have to monitor the patient vitals closely. Also stop that medication. I don't know, it's like I'm not following the steps.
No,
Let
but
me
it's
try and
fine.
follow.
Go on.
Okay. We'll stop the medication, monitor the vitals, and quickly check the list of antidotes that we have available in the unit for if at all it's a harmful medication that could bring possible side effects or how do they call it? Adverse reaction. Yes. So we'll check the list of antidotes and see what we can give if at all there is any adverse effect that is occurring before the doctor arrives.
All right. Thank you very much for that. So you've, in as much as it's not organized, it's fine. You've given the answer, which is informing the patient, stopping the medication, telling the nurse to inform the patient. She also needs to inform the in charge of the ward. You also need to incident report it because you noticed it and she needs to incident report it. Inform the doctors, inform the family, and also you need to evaluate and see if it's, especially if you are the charge nurse on shifts, you see if it's something that probably she needs more education on, then you probably clear her on it, explain to her properly in terms of medication assessment, and then you encourage her that just in case she's having any doubts, she can always reach out to you and you can always support her. So you support her during the care that she's giving. Thank you very much for that, everyone. So let's go to questions of conflict management. Okay, conflict management. So we've dealt with medications, we've dealt with what's the name? We've dealt with weakness. So we are going to conflict management now. So in terms of conflict management, before I continue, do we have any mental health nurse here? Mental health nurse interview. We don't have mental health nurse. Okay, that's fine. So I don't need to ask mental health questions then. Okay, none. All right, that's fine. So let's go to what's the name? Let's go to conflict management then. Conflict management, a colleague of yours came to meet you in the ward and shouted at you when you were offering care. What will you do? If you know the answer, kindly respond.
I'll first of all try to calm down my colleague down. I'll stop whatever I'm doing to actually show a sign of listening, as if I'm listening. I'm trying to listen to what he or she is trying to see and understand what exactly the message he or she is trying to pass. After listening, then I can softly respond by saying, can you let us talk about this? I know you're upset at the moment. Do you mind if we talk about this? I'm really sorry for whatever that might have transpired before now. Sincerely sorry, but for the sake of our patient, can you let us just talk about this somewhere else? And then we can take it up from there.
Okay, thank you very much, Mr. Junkpo, for the answer. Thank you. Does any other person want to add or subtract?
Yeah, I have something to say. I don't really know if he's contradicting to what he has said.
Okay.
But to me personally, in this kind of scenario, first of all, it's unethical for my colleague to come in front of my patient and start shouting for me. So, and in anything that I'm doing, I have to first of all prioritize my patient. So in that case, I was attending to my patient, and then my colleague walks in and starts shouting for me. First of all, I have to finish with what I'm doing with my patient at that time. I apologize to my patient for that kind of dirty scenario. And then I walk up to my colleague and now know the reason why she has done that kind of thing. And If it's not adding up, then I'll report that to our head nurse. Then we'll go up from there.
All right, thank you very much, Nurse Clinton, and thank you very much, Nurse John Paul.
Please, I want to say something. I'm a mental health nurse.
That means if I ask the question, you must respond, though.
I'm a mental health nurse, so
You
please.
respond, though. Okay, no problem. So going back to the conflict management. So first, it depends on the nature of the shout. If my colleague is shouting, "Stop that medication," or "Why are you doing that?" It's wrong for her to do that because it could undermine your qualities in front of the patient. That's fine. But if your colleague is shouting to try to warn you of an error you're about to make, I could probably turn and listen to what she has to say. Like just that initial stop and then stop it. But after then, I will go and meet her quietly and tell her that, "Oh, thank you for correcting me. But in the next time, could you please call me aside to stop so that I could stop the mistake I was making, rather than shouting like that in front of the patient, and speak to her amicably." But if it's the kind of conflict that the person was being rude to you or something, and you're administering care to your patient, first and foremost, you prioritize your patient, like Nurse Clayton has said, and then I'll prioritize my patient, offer the care I'm rendering to my patient, so that the care I'm rendering to my patient is not obstructed or is not interrupted, sorry. And after then, I will go and meet my colleague, because for you to resolve conflict, I repeat, you can't resolve a conflict in the presence of your patient. So whether she shouted at you at that time, even if it's to warn you, you can listen and stop probably the error you're trying to make, and then call her aside to speak to her. But you don't do that calling aside or speaking to resolve that conflict with the patient. So it has to be done outside once whatever has been done with the patient completely. And then you speak to her, you try to find out what it is you have done wrong, and to see if it's a fault from your end or if it was a misunderstanding. If it's a fault from your end, you apologize. If it's a misunderstanding, you try and resolve it amicably. Or it could be related to her family issues. Some people that they've had a bad news, and then they're just transferring aggression, and you guys will resolve it amicably. But if the conflict is still affecting the care of the patient, and you've tried to resolve it amicably and it's not working, then you report to the nurse in charge. And if the nurse in charge is not still able to resolve it, you report to the senior or the ward manager of the ward, and that will help in resolving the conflicts. So both of you got it, but it's a two different scenarios. So you need to know which of the scenario. So if they say, you say, okay, it depends. If it was a shout to correct, then I'll probably correct the mistake and then meet her aside. But if it's something that is rude and all that, I will complete my care with my patient first before I go about going to meet her and resolve that, because patients come first at the end of the day. So that's in terms of conflict management. So you meet. So that's the conflict management is just all about you knowing how to call the person aside, correcting the person, trying to resolve it, or reporting, escalating if it keeps proceeding. This same conflict management can also be used in terms of doctors. So you've told a doctor that they're supposed to wear an apron to go into a room and wear a face mask to prevent spread of infection, and the doctor is still doing that same thing. So you need to call the doctor aside to speak to the doctor. Let him understand the implication of things. Speak to him, and if it's still not resolving, you now have to escalate it to the nurse or the nurse in charge or the ward manager, who will escalate it to their own senior doctors. And the senior doctors will come and reprimand them for their actions. So that's the way to resolve conflicts. So you just need to understand all those sort of things. So let's go to the 4 questions. 4 questions. Now, this question is both for mental health nurses and both for, what's the name? Both for general nurses. So you meet a patient, you enter a patient room, you want to check a patient's vital signs, and you see the patient on the floor, unconscious. What will you do?
Let me answer.
Thank you.
Okay. When Thank you for giving me the opportunity to answer. So when I see this patient on the floor, I will first assess the scene for safety.
Good.
So after assessment of the scene for safety, I will ring the bell, emergency bell. Well, while the help is on the way coming, I will start my vital signs. If the scene is safe, I will just start my vital signs. But if the scene is not safe, maybe it's something that I need to remove patients from there, then I will do it. Before the coming of before I will get help from maybe emergency bell that I just pressed, I will continue giving the vital signs, monitoring the patient.
When you say vital signs, you need to be specific.
Okay, like taking of the temperature, blood pressure, pulse, oxygen saturation, and this patient, I think you said this patient is unconscious, right? Okay, yeah, I'll be monitoring the patient before I get help. Then when the help now come, we'll continue from there.
All right. Thank you very much for your answer. Do anybody want to add or subtract? Do anybody want to add or subtract?
Okay, let me add something. Something I think it's important.
Okay.
So once you've checked for scene safety and the scene is safe for approach, then you do a holistic assessment. Check for then the vital signs. Check for signs of life. If the person is still breathing,
okay, go on.
Then then that's after calling for help. Then you begin CPR.
Correct.
While waiting for help. Then when the help arrives, then they can take the patient, and then they already know that they should continue with the resuscitative measures. And then you can also tell them that if they need further information, they can call you.
No, you'll not go anywhere. You'll be there to give us the information. You are there standing until everything is resolved, because they might need supplies, which you are the nurse and you know where all the supplies is. So you know, and then you also don't forget to document and inform the family as well. So first, you enter the patient's room and the patient is unconscious. Most of the time, they want to understand your emergency. That question most of the time is an emergency question. They want to see what your response is as a nurse in terms of emergency. So you walk into the room, you check for scene safety. The scene is safe to approach. Then you have to go and check for signs of life in the patient. Are they breathing? Is their airway closed? And all that. If they are not breathing, there's no pulse, you start CPR. But remember, you must have called for help. Then you start CPR. Once you started CPR, you continue till help comes, and then you guys continue the resuscitation measures. Make sure the family is informed. Make sure you are there to support, because the patient might need to go down for a scan. Patient might need further support. So you are there to render the support. Ensure the emergency drugs are also being brought in. You understand? The support would have come already, and they would have brought the trays and all that for the emergency. But if it's not there, you bring it. At the end of everything, make sure you document, make sure you continue assessment of the patient if the patient is being revived, and also make sure that you inform the family. So that's just how to do emergency approach. Let's say now, right, you enter the room, this patient is a confused patient, or this patient is a mental patient. The patient has issues with their mobility. This patient, you enter the room, is on the floor, but the patient is not unconscious. The patient is conscious, but is on the floor screaming, "Help me, help me, help me." Patient on the floor. What will you do?
Okay, so I'll try again.
Okay.
So I enter a room and I see a patient, a confused patient on the floor.
whether it's not confused or so.
So
Patient
first
is
of
on the floor. Go on. All right.
okay, so I'll check for scene safety to ensure the scene is safe for approach. Then I'll approach the patient and assess the patient. Okay, call for help. Then for lifting the patient, we'll be using the safe and handling. I don't even know how to say it.
Safe and handling technique or safe and moving and handling technique is still fine.
Here, moving and handling technique. Then we'll lift the patient. Then I'll do a fall assessment. Check why the patient fell down. Then I'll place the call bell close to the patient. If the person is confused as said, then I will like reorient on how to use the call bell. Then remove clusters around so that the person will not have to, in case she's moving, maybe he or she is moving, not have to trip on anything. Then if the person is using a moving device, a working device, I'll place it close to at a close proximity. Then most things that the patient will need, I'll keep it close to the patient's bedside. Then I will inform the doctor and my ward head, and also fill an incident report form stating what happened and measures that I took to take care of the situation.
Okay, thank you very much for that. So, for the sake of time, you've done very well. You've answered very well. One other thing I want everyone to take is, which should have been the next question I would have asked, is how would you prevent falls? How would you prevent falls? She has mentioned about ensuring that you remove clusters, you orient the patient, whether the patient is confused. Some patients that can, even if you arrange, they don't know how to use it. But people like dementia patients, people like what's the name? People that forget things, yeah. So you can reorient them to using the call bells, or those that are having mobility issues as well too. You can give them the call bell closer so that they don't need to stretch further to get it. Get their mobility equipment and keep closer to them if they use it to walk around. Probably that was what they were trying to get, and that's why they fell down. Try to put the right slippers wear on. Try to ensure that the floor is free from maybe there's no liquid on the floor that could be a hazard or any potential hazard to them. You try to ensure that everything is away. If it's a patient that is confused, try to ensure the bed is at the lowest level as possible, and ensure that the side rails are being put up. All these are measures to prevent falls. So she has already mentioned it. Now let's go to the question of the patient is okay. The patient is like on the floor, right? But he's conscious and is screaming for help. You get to the room, you check for safety. You do holistic assessment of the patient. Okay, how is the patient? What's the obs? What's the vital signs? Why the patient is still on the floor? You do observations. You check if there's any physical wound you can see around the patient. If there's none, you would have called for help. You understand? So you call for help if you haven't, but initially you call for help. But if you haven't, you can still call for the help. Then you and the help, once the help has arrived, never, ever, ever, ever lift a patient by yourself from the floor. Never do that. To ensure you and the person lifts the patient up using the manual moving technique and place the patient on the bed. The doctors should be informed so that they can come and review the patient. So even if you have reviewed the patient, the doctors need to come and review the patient to assess if the patient has probably broken their hip or done damage to any part of their organs. They might need the patient to go for X-ray or any scan to have a review on the patient's body. All right, to see if there's anything wrong with the patient or not. So once they have done that, you also need to, what your role will be there, you will keep doing observation and vital signs. You do neurologic assessment of the patient, like checking their GCS, checking if they can still move their hands to be sure they haven't fractured or punctured any of their nerves that will prevent them moving any of their body. Now, once you've done all that, make sure you've documented all that happens. You ensure you put measures that will prevent such fall from reoccurring again. Just like she has said, all those measures, you put them up to prevent it from reoccurring. While you've done that, make sure you document and make sure you inform the family on what has happened. Make sure you do incident report on what has happened, and the senior nurses are aware as well. So that is what you do when the patient is on the floor. I hope I've not said so many things, so it's just the same thing that she has said. Just I've added one or two things, or try to clarify one or two things so people will understand what you do when the patient is on the floor. Now let's go to pressure ulcer assessment. Both mental health, both general nurse and everything, wherever you are, so long the patient is not mobile. So long the patient is not mobile, we always do a pressure ulcer assessment for the patient. So we have to assess to see if the patient have a pressure sore, and you document it. Now, my question to you guys is, how do you prevent pressure ulcer in a ward? And if the patient already have pressure ulcer, how will you care for it if you have a patient in a ward? Over to you. Can we have the males respond now? Because we've had females respond for a while now. Let me see how many minutes I've gone. Oh, I've been here for a while. Well, okay, let's go on.
Yeah, if I have a patient that has already developed pressure sore on the ward, or newly brought in patients with pressure sore, number one is to grade the depths, the surface and the depth of the pressure sore. Number two is to measure the surface area, just like assessment of that pressure sore.
Just assess is
That
fine.
is
You don't
good.
need to go
Just
too deep.
assess, yeah, just assess, just like assessing the pressure sore. And then if you have a tissue viability person, you can inform the person and then get appropriate solutions, ointment, and then the wound care. You can do a plan for the wound care. If it is a oozing wound and all of that, the person will sort it out. Then depends on the site of that pressure sore. I want to use the gluteal area as an example now. So the patient should be placed on turning chart.
Good, correct.
You have to create a turning chart for the patient. And basically ensure that the patient is not having an external, maybe let me say urine soiling. If there is need for catheterization, you can catheterize. If this patient that can still move, you can start offering bedpan, encourage bedpan. Or if a patient that is paralyzed, you can do a catheterization, and that's it.
Okay. Patient that is paralyzed does not mean that paralyzed, correct, especially if it's 4 limbs paralyzed. So you can do catheterization. Correct. Thank you very much for that. In addition, you can ensure that the linens are always like dry, and it's not like the ones that are crumpled or soggy or welts, because all those can provide more room for more pressure breakdown. You can also ensure that there's good nutrition, so the patient encouraging diet, encouraging fluids, to ensure the skin and everything is being like the body is nourished, because that could also help. Because when someone is not nourished, that's another risk of pressure sore area. So this is just in addition to all you have mentioned. I know that, which are very much correct. So thank you very much for that. So let's go to clinical questions now. All these are clinical, but core clinical. So you have a patient that has a low blood pressure and high pulse rates and increased respiratory rates. What will you suspect?
Normal temperature.
Normal temperature.
Please, can you ask the question again?
You have a patient, right, that has a low blood pressure, a high pulse rate, and a high respiratory rate. In normal temperature, what will you suspect?
I think hypovolemic shock.
Okay, correct. It's a shock, but it must not necessarily be a hypovolemic shock. It could be other sort of shock as well too. But go on. But it's a shock, correct? So how will you manage the patients?
Like you said, it depends on the type of shock. So if the patient is if it's hypovolemic shock, then you give enough fluid. When you give enough fluid, then you give, if there's any prescribed medication that the patient has at that time to take that won't contradict the situation already, then you give, and then you monitor the patient for a few minutes, maybe 30 minutes, then assess, check the vital signs too within your monitoring stage, and then inform the doctor or your senior colleague that is on duty or the nurse in charge of the ward, and then make proper documentation.
Correct. Thank you very much for that. So let me add, systematically, you need to assess your patients. It could be that the patient just came back from surgery and is bleeding somewhere. So you need to note the cause of what's happening. It could mean that the patient is just dehydrated. That's why the patient is having that sort of thing. You understand? So you need to assess the patient totally to know what's going on. You do proper assessment, head to toe assessment, check, especially if it's the patient history normally. So you know what the patient is having. That's one. It could also be anaphylaxis shock as well, too, which could come in that way, it could come with normal breathing issues. So you noticing what is actually happening, and then you check. If it's a hypovolemic shock, the patient might need to be given IV fluid. If the patient is bleeding, you must inform the doctor, and maybe there are emergency drugs, depends on the hospital you're in, that you can give. Maybe there are some emergency drugs you can give without the doctor's prescription, you can administer, but if not, you have to immediately inform the doctor. Or if it's a massive hemorrhage, you need to shout for help for you to stop, so that the bleeding can be stopped, and then more fluid and blood can be administered. You also need to keep an eye on the patient's input and output, so that you can keep a close eye to know if the patient is taking in enough and if the patient is coming out enough. Because while you are trying to give more fluid, you don't want the patient to be fluid overloaded. Okay, so that's a way of resolving what's the name. And that you also need to check if the patient is having high respiratory rates. What's the patient's saturation? Is it low? Does the patient need to be oxygenated? So you need to give oxygen if needed to the patient. If you've tried to give IV fluids and the patient is still having low blood pressure, does the patient need vasopressor support? So the patient might be needing vasopressor support, and then the doctors will need to be informed, and the doctors, they can come over and take over on what has happened. You make sure you have documented what has happened, and that's to carry on from there with the treatment, continuous assessment of the patient. So that's how you manage such patients. So depends on the course, you treat according to the course, but you can start from, if it's hypovolemic shock, you check the cause, you try and see how you can give IV fluids. If the patient needs oxygen, you administer the oxygen. If it's other sort of shock, you try to see how you can help to resolve it as well. So, but you can focus on, if you're only strong in hypovolemic, you can focus on that, and then at the end you can say if there are other type of shock, you can go about measures to resolve it, so that you not put yourself inside shoe that you cannot overcome. So focus on the one you know very well. Oh, my patient could be having shock, so I'll check the history and see, okay, if my patient just had surgery, I also check, is he dehydrated? Most of them might be dehydrated, so might need IV fluids. So you just highlight on the fluids intake and all that, and how you can also see, does the patient have a cannula? You put in a cannula. Does the patient need to be oxygenated? You put that up. Once you've done all that, you can say it could also be other type of shock, though it might not be IV fluids. So I'll make sure I've informed the doctors who will come and review, and they will treat depending on the type of shock. So that kind of thing already gives you an answer. So what if the patient now have high temperature? The patient is now getting more confused and has a urine that is smelling and reduced urine output.
Sepsis.
No, Everybody knows sepsis. Everybody wants to shout, sepsis, sepsis. Oh, yeah, manage sepsis for me. I'm waiting for you. Oh, yeah, manage it, Nurse Janet.
So, since the temperature is high, you can
Okay.
touch the patient,
Mm-hmm.
then exposed to fresh air, and if they check for the saturation, then if it's low, we can give oxygen and also the antibiotics then can be given, then also antipyretics. Then we monitor the input and output of the patient, and also blood samples to check the full blood counts, whether there is elevated WBC. Then we can give IV fluid. After assessing the patient, if the patient needs more IV fluid, it can be given to the patient. And also there's something called lactate to check the lactate level of the patient. That
Yeah.
means if there's high lactate, we give more fluids.
Correct. I love that. Well done. Well done. Well done. I don't know if you're using Buffalo, but that's a good one as well too. So you've actually highlighted everything. Seems you're using Buffalo, but that's good. So anyone that doesn't know what Buffalo is, it means blood, the urine, the fluids, the what's the name? Antibiotics, antipyretic. Remember, you can give paracetamol to bring down the temperature, the lactate, and the oxygen. So that's how to manage sepsis. And she has actually mentioned everything about it. You need to take blood, to send for blood to check if there's high WC, the CRP, and all that. So they need to take some blood samples to check that. You need to keep an eye on the urine output to know if it's low. If it's low, the patient might need more fluids. If it's concentrated and smelling, the patient might be chronically dehydrated. And we need IV fluids. That brings us to F, which means fluids, giving IV fluids. Our patient temperature is high. Patient might need antipyretic or tepid-spongin. So you might just tepid-sponge. It might be the case of releasing the patient's clothing and allowing more air to come into the patient's body, or you might just have to give antipyretic like paracetamol. If patient is prescribed antibiotics, you give, or they prescribe it for him, you can give some antibiotics. You check the lactate. Patient might just be seriously dehydrated, and you need to give the patient IV fluid so the patient will not go into acidosis. And then oxygen, you need to give oxygen to the patient because at times the patient's oxygen saturation might be low. And she has mentioned everything. So thank you very much, Nurse Janet, for that. Now,
Sorry, please, what's L?
Lactates.
Okay, Laxix.
Lactates.
Lactates.
Lactate. LACTATE. Lactate.
Oh, okay.
Lactate. Yes, thank you. So I think there was someone that said she was, let me just check the chat to be sure. She said, I want to be sure she's still here. If not, she said she's a mental health nurse. That's Nurse Pat. Is she still here? Yes, she's here. Okay, so Nurse Pat, can you tell us about the Mental Act, the Mental Health Act? That's your question as a mental health nurse.
Mental Health Act.
Yes.
I can say it's an act that governs the mental health management. I don't know it. I'm just saying it.
All right, that's your assignment.
Okay.
Try to research more. Now, how about when do you deem a patient lacks mental health capacity?
Okay, when a patient cannot speak for himself, when the patient is incapacitated, he cannot speak for himself. So that is when I can say that the patient lacks mental capacity.
So there are 4 mental health capacity assessments. All right. Now this question can be for everybody too, but I want to focus it on mental health because for you to say a patient have mental health capacity, there are assessments you need to do for the patient. And if the patient score 3 out of the 4, the patient is still deemed to not to have mental health capacity. There's a capacity that says that everybody is said to have a mental health capacity or a mental capacity unless deemed otherwise. So everybody says the MCA, that's the mental capacity, says that an individual has the capacity to make a decision on themselves unless it has been proven that they cannot make that decision. And in that case, it might need a next of kin, or it might need somebody to, or you might need the doctors or nurses to come in to make that decision for the patient. Now, how do you know if a patient do not have mental capacity? Normally, you will see that the patient can understand the information relevant to make a decision. That's number one. Now, you give the person an informed decision. Like you're telling the patient what like you're speaking to the patient, this is what you have and all that. You can see that the patient understands after you've told the patient the information. The patient can understand the information. Number one, the patient can retain the information, because people that are dementia, although some of them still have mental capacity, but the ones that are advanced, that's really, really advanced, that if you tell them information now, within 1 second, they cannot retain that information. Those ones don't have mental capacity. But those ones that are still in the early stage, they can still remember. You just need to reorient them. So those ones still have mental capacity, because when you reorient them, they already know everything that has happened. Okay, so there are people that they cannot retain the information that you let them. You just told them and they've forgotten it. So you need to score them on that. And then their ability to use the information that you have given to give a meaningful decision. Okay, it's not when they say meaningful decision, it must not be in line with what you have said. Not every patient will tell you give a reply yes or no. But if the patient are saying no, you need to use the information as part of the decision-making process. You need to give a reason. Oh, I don't want that. Okay, I've had this before, and when I had it, I had an issue, so I don't want it. I don't want it. Do you understand? So it could be like that, yes. But you cannot be telling the patient something, and the reason they are giving, you've looked at it, and even the way they're acts a bit strange. You know that the patient might not have mental capacity, so you can do other assessments to find out, and then the patient can be able to communicate their decision in any way. So those are the 4 mental health capacity acts. Not mental health acts. Mental health acts is different from mental capacity. Okay, so for the mental capacity, those are the 4 mental capacity. They can understand the information, they can retain the information, they can use that information to make a decision, and they can communicate that decision to you. That is the Mental Capacity Act. For the Mental Health Act, like you said, is an act that governs the ability to take care of people that are mentally disabled. When they say mentally, it's not just only schizophrenia. Someone that is paranoid, someone that is that probably that has post-trauma PST, forgotten, but you know what I mean anyway. So that's PTSD. Some people have that. It could be something that is very, very minimal, just anxiety, depression.
Post-traumatic stress.
Yes, that's what I wanted to say. Anxiety, depression. People might have that. So your ability, Mental Health Act is an act that governs and protects these people and ensure that you are protecting their interests, you are safeguarding, and that you are not restricting them. They have the ability to still make their decision even while they are still having that Mental Health Act. So you are governing their care and giving them care so that they are not being abused. So that's what Mental Health Act is all about. Assessment, protecting, safeguarding, implement. So you need to go and read up on mental health acts, because it's one question they normally ask people that are into mental health, because they want to know that you understand what it is to take care of a mental health patient. Now, how do you safeguard the patients? Sparks.
I'll safeguard the patient.
What do you understand by safeguarding?
Safeguarding is protecting the patient from harm, any physical, any kind of harm. So that is safeguarding, ensuring that your patient is safe.
So how do you assess and safeguard your patients?
I will assess and safeguard my patient by ensuring that my patient is being monitored in a therapeutic environment, in a safe therapeutic environment, one. Then ensure that my patient is not being bullied. I monitor my patient from bullying, self-harm, ensuring that my patient is not having anyone around, maybe bullying the patient, mental, how do I put it?
Now, if you
Bullying.
want to guide your patient, you have to, first of all, you need to assess the patient. And how do you assess? Ensuring effective communication. Some patients might have been abused and find it reluctant to communicate with you. So you need to develop a relationship with the patient to ensure and to establish safeguarding. Now, once you've identified that the patient is at risk, or you've identified that there's something wrong with the patient, you will probably have to document it and inform the safeguarding team who will come in to assess and to review. At times, to safeguarding might also involve you doing the information to the police, but depends on the level of safeguarding it is. But at times, you just have to do a safeguarding documentation and refer out to the safeguarding team to come and speak with the patient. You also have to ensure that the patient is in a safe environment. You're communicating with the patient, you're observing the patient, and ensuring that the patient needs are being met. So those are ways of safeguarding patients. Okay. Now, you have a patient that is suicidal. How will you manage that patient? The patient is brought to you to the hospital and the patient just tries to commit suicide. How would you manage the patient?
I will manage the patient in a calm and private space, and I will try to ensure that the patient, that is, I will create a rapport between myself and the patient, ensuring that the patient has I gain the patient's confidence. Then I will talk calmly, trying to establish, understand the reason of the patient trying to commit suicide. So after establishing the reason, after the whole assessment, I will now plan my action using what I got from the patient, assessment. I will plan towards that. For example, assuming that I got to know that my patient is trying to commit suicide, maybe due to heartbreak, that maybe a friend dumps her, I will counsel my patient and involve his family if she gives the consent. That if the patient said that he doesn't want the family to know, I will just talk to the patient, try to make sure that he's in a safe place, escalate the condition if it is bad to the ward manager, if it's something I cannot handle.
Okay. So to manage a patient that is suicidal, you need to understand that managing a patient that is suicidal has to do with, number one, assessing the patient, and also having to do with providing safety for the patient. Okay. Number three, your ability to recognize suicidal thoughts, your ability to recognize suicidal harm, when the patient will still want to harm themselves when they're rendering what's the name, when they're taking care. So you need to monitor for suicidal risk. So how do you manage this patient? Number one, I'll need to ensure that my patient is on close observation. I'll try to ensure that the patient's bed or the patient's room is as close to a nurse as possible so that I can keep a close observation to prevent reoccurrence to that patient, because the patient that is suicidal might want to risk themselves of doing that again. Number two, I'll try to ensure that I create a communication rapport with my patients. At times, it could be that my patient doesn't feel like they need someone to talk to, or my patient is actually it's those that are having like that are being abandoned, or someone that they don't have someone they can trust, and that's why they are carrying out suicidal acts. So I try to rapport with my patient to understand my patient as a person and tailor any other care I can give towards that patient. I also have to ensure that I inform my fellow team staff so that they can also try with and see in a way we can create a plan to protect our patients. I also have to understand the risks or suicidal risks or monitor the suicidal risks. Example, my patient just suddenly becomes happy just like that. My patient probably was depressed for a while and just suddenly becomes happy. I will observe that maybe my patient has created a plan of wanting to kill himself or something, and he has successfully created a plan and is now happy, and that's why he knows when he's going to strategically carry out that plan. So all those signs of suicidal risk, I will note that and be able to use it to take care of my patient. I also ensure that there is no risks or any sort of harm, things that can harm my patient, things like sharps, things like rope that can be used as a suicidal stuff or a suicidal equipment. I will ensure that all of them are being kept away from my patient so that my patient won't carry out the activity. I'll keep close observations. The doctors are being informed and carry on my documentation. I also make sure that I've informed the safeguarding team and done a safeguarding referral so that they can come and review my patients. Okay? That's how to manage a suicidal patient.
Thank you.
All right. So, and there are also other questions. When a patient, how do you try to control the weight of a patient? Because people that are having mental illness, they tend to add weight. So you need to know ways to control, help in managing weight gain. Some psychotic medications increases weight for a patient. And at times you might just engage patients in physical exercise. It might just be patient need to walk around the environment more, or physical therapy, or creating a group therapy, or such sort of things. So those are little things you need to know when you're answering mental health questions. So hello Ma, please can you tell us about a time you demonstrated communication as one of the 6 C's as you cared for a patient? Okay, so a time in which I've demonstrated communication as one of the 6 C's. Communication is one of the key skills in nursing. We can't do without communication. And so from the time we walk in as a nurse to the time we leave the hospital, we are always communicating with the patient. At times, there might be barrier in communication due to language barrier, due to misunderstanding. But whenever I resume my duty, the first thing I try to do is I try to understand my patient and try to give a listening ear. There are so many communication skills, and I normally use 3 of them very well, which is number 1, giving a listening ear to my patient. I listen attentively because listening can give me an example of or give me an understanding of what my patient needs. And that's what I do all the time. Whenever I go to my patients, I try to give a listening ear and tailor my plan for that day according to their needs. If it needs referral, I refer my patients to the respective body to carry out the activity. Another thing I do is I try to use silence a lot. Silence is one thing that people don't really use when giving care to their patients. And at times the patient just need you to sit down with them and hold their hand and just listen to them while they cry away. And then they just need to know that you are there for them. And I try to use that communication skill when dealing with my patients. And that's what I try to do when dealing with my patients is try to ensure that I prioritize their needs. I try to ensure that whatever thing they say, I try to put it into consideration and use the cues, because at times the patient to communicate to the patient, especially a patient that is difficult to communicate with, you just need to use the cues. They might be giving you cues like, oh, my family is I'm in the hospital now and no one is taking care of my kids at home. Those are cues, and I've had patients give me such a cues within the hospital. And what I do is that I try to reach out to the social care team to ensure that they follow up their family or their care at home, because at times a patient might be a bit unsettled or maybe a bit difficult only because they are worried about their personal life, and your ability to come in to listen to their cues and use it to offer care enables you to render good care. So I always do that, and that's how I communicate with my patients. That's one way to go about it. You can go about saying, okay, how have I communicated with my patient? Communication is one of the things I do every day as a nurse. So whenever I resume work, I try to establish a rapport and understand my patient needs, and then I go further to caring for them. I want to give an example of a time whereby I had a patient who was really worried about her family back home. And a lot of people said that she was quite difficult, but she was not really quite difficult. The only reason why she was proving difficult was because she was worried about her personal life, and she just needed somebody she can communicate this to. And everybody was so busy that they didn't really have time. But because whenever I resume duty, I always try to listen and understand my patient, I went to meet her, and with our communication, I understood her need and I was able to attend to her need. Full stop. Okay? So I hope I answered that question. Nurse, what's your name? Nurse Janet. I hope I answered your question. I hope you are here when I answered this question. Hey, she asked the question and she's not here. Please, did we benefit from that answer? So before I go, because it's already, we've been on for quite a while, I'll try to give you guys few tips, okay, when you're giving an answer to a question. Number one, avoid unnecessary lengthy answers. Try and stay specific to the questions that they ask. Try to listen to the cues, and so long you understand when you're giving an answer, right? And they tell you to give me, like when they say, can you tell me the quality and role of a nurse? Just remember this person's specification and try to use that and give an example. So if you're thinking of, oh, which quality should I highlight? Which quality should I use? Think about the person's specification and use that to present yourself to them and sell yourself to them. You can always use that. When they ask you about nursing process, you can use assessment, planning, evaluation. You can use how you've worked with multidisciplinary team. You can use how you've carried the patient relative along and all that. When they ask you, how can you improve quality care? You can use audits, you can use clinical governance, okay? So these are little ways in caring for, or to know how to prepare for an interview. They won't ask you so much questions. They'll probably ask you questions regarding either infection or control. At times, you need to know the number of, so like in the USA, they might ask you the number of beds you need. And at times, what you just need to know is what type of person are they looking for? Are they looking for someone that have experience in an acute setting? Are they looking for someone that have experience in accident and emergency? If the role is for accident and emergency and you have experience in accident and emergency, make sure you highlight it when you are giving an example. If you don't have experience in accident and emergency, and that's the role, but you're taking care of medical, surgical patients, people that they see every day in accident and emergency are people that have this condition. So you highlight the conditions. Those are ways to give answers to questions. Remember to be confident, okay? That's how to give answers to question. Now, NHS question is all about into pressure ulcer, falls, medication management, clinical questions like when blood pressure is low, shock, sepsis, and all that. Their question is about infection and control. Their question can be about safeguarding. Their question can be about communication. Their question can be about, tell me about yourself, or they could ask you, what are you bringing to the table, or why do you want us to employ you? They could ask you a question like, why do you think you are best fit for the role? Why do you think we should take you? When they ask you that question, always remember the person's specification and tell them why you are the best person for that role. Oh, you could say you need this thing and I have this thing. I've demonstrated this in this place and I'm sure I have it. So I think I am the best for the role. So that's a way to answer that question when they ask you why you think you are best for the role. So I believe I've answered most of the question. Time is fast spent now. I don't know if you have any question bothering you that you want me to answer please ask the question and we'll see how we can attend to it. Thank you.
Hello, ma.
Hello, I'm
Thank,
listening to you.
yeah, thank you so much, ma. Really appreciate you. Ma,
Thank
please,
you.
the question I asked the other time about communication.
I
Please,
responded
I want,
now, but your network, I was responding, your
yeah,
network was going
I was
haywire.
locked out. I'm
Yeah.
sorry. I don't know if you can go over it again, ma. I'm so sorry, ma.
You will watch the video. I'll send you the link so
Okay,
you can
no,
watch the
no
video.
problem. No problem. I've forgotten that it's being recorded. I'm so sorry, ma.
No, it's okay. It's okay. It's fine. I would have gone over it. I was about to go over it, then I remember, oh, it's recorded, so you can watch the section.
No
That's fine.
problem. Thank you so much, ma.
Thank you. Do anyone have any other question and you want me to answer? Okay,
Hello,
go on, Kristen.
thanks so much for everything you've done so far. Please,
Thank
I have
you.
this question about what are the challenges you're likely to face upon your relocation that I've been struggling with? I don't know what is the best response to give to that question.
Okay, so you could go like this. Thank you very much for the question. I believe that one thing that people do have challenge with is change. And although I'm someone that can easily adapt, I believe because of language differences, it might take a little while for me to understand what people say. So you could focus on language in the sense that I do speak English, but although I might have issues with accents, understanding accents, but I believe that this will not be an issue over time because once I've gotten used to the accent, I will begin to understand much better. So you can focus on accent that although you speak English, but accent might be an issue as far you might not understand what they are saying and they might not understand you very well. But you believe that over time, you begin to understand the accent and it will improve better. So you can go that way. So that's the safest way I used to tell people to go. Or let me think of another one that you can go for. When they ask you what challenges do you think, okay, you might say, oh, all right, thank you very much for that. Well, although I really want to love to experience what's the name travel out, but for the fact that I will miss my family back home, that might be one challenge, but it's not an issue because normally I travel interstate. So in as much as I'll meet them, I'll always communicate with them via video calls and I'll be close with them. That might be one issue I might have, but I think that over time it won't be much of an issue as normally I don't normally stay with them at home, but we communicate via video call. So I might just continue with that. You can give an example of food. Because of food within where I'm at home, I worry about the food as I don't know if I'll be able to adapt to the taste of food. But I've heard that there are locations whereby they sell African food, so I'll probably adapt better. And over time, my taste will probably adjust to the taste of cuisine that comes in from the environment that comes in my taste will adjust to the British cuisine and it won't be an issue anymore. But that's only my major worry. Apart from that, I think I'm fine. So you can go like that, and that's a safe bet. So rather than one big thing, so that one alone is already fine. I could be like, oh, I think moving to a new trust, it might not be easy to understand their policy and principles, but I know that the NHS is a trust that normally helps with adaptation. They teach us on how to adapt and they help with programs that can help you to adapt easily. So I believe with those programs and with my seniors teaching me the policy, that won't be much of a challenge when I come over. Is that okay?
Okay, how about you talk about the weather condition there?
Exactly. You can use the weather condition as well to, oh, where I am is a hot weather. Coming over is a cold weather. Yes, I understand that being in a cold weather, I might have challenges of cold and all that because it's not a weather that I'm used to. But I've had friends who have adapted and they've told me tips on how to adapt, on how to ensure that I'm properly covered and all that. Although it might be a bit challenging, but I believe that with the tips that my friends have given me, I'll be able to overcome it.
Thank you very much.
Yeah, you're welcome. Any other question?
Yes. What if they ask, do you have any question to ask after the interview?
Please ask question. Ask question. So do you have any questions? Oh yes, thank you very much. So I understand that the NHS normally provide trainings for us just because why we have our method of practice. I believe the UK have their own method of practice. Please, can I ask if this trust will provide such adaptation program? That's one. So so it makes them know that, oh, she's actually keen on growth and development and adjusting to their policy. So that's a question to ask. Or you could ask question like, oh, okay, so after this stage now, what's the next step towards what was the hospital process in welcoming new people, or what's the hospital process in continuous practice and development? So you can ask how the hospital helps in continuous practice and development. You can ask that type of questions as that. So those are just questions that make them know that okay, this person is interested in us. Or maybe there's something you saw. You now say that, oh, does the hospital give room for because I'm someone that likes to be creative and someone that likes to ensure that I contribute to my quota. Does the hospital give room for creativity, as I would like to work with a team of creative people? You can put that as well. That's another question, so you can ask them. Does anybody have any other question that you want to ask let's give us tips? Because me, those are the kind of things I would ask you. Say, when is the best time to declare my health challenge to a recruitment team? Your health challenge, when you have gotten the job, you don't need to present it on your interview. Okay? Once you have gotten the job, they know the business. The NHS are not allowed to disregard you or say because you are sick, then they will not grant you. Depends on your level of sickness. So if you have a health challenge, once you have gotten the job, they will definitely ask you for health. You will do health clearance and health assessment. They will give you the documents to fill. So during that time, if you are filling that document, right, you can put in the health challenge that you. Okay. So that's when you put it. So Nurse John Paul, hope I've answered your question. In regards to, sorry, I deviated because I saw a question in the chat. She was asking when she should declare a health challenge. So that's why I had to answer that question. So, Nurse John Paul, I hope I've answered your question.
Yes, you have. Thanks a lot.
Thank you very much. So, in the absence of no questions, again, thank you very much for today. Please and please, we are pleasing with you. Once you have done your interview, try and send us your questions so we can also help future people. We normally post questions on our groups as well too. So whenever you send us those questions, we don't hold it, we don't store it and say we want to use and make money, nothing like that. We carry it and we give it to the public so that they can use it and prepare better for their own interview.
Please, do you have a WhatsApp group? Do you have WhatsApp group?
Are you not on our Telegram group? Our Telegram interview group.
Is it a EMR something?
I will send it to the group just in case
okay.
you don't have it, so you can join our Telegram. We have a Telegram group for
I appreciate that. Thank you.
All right. Okay, no problem. Thank you very much, everybody.
Hello, Ma. Hello, Ma. Please.
Okay.
I want to understand the process it takes to make job applications, the express team.
Okay, is it like you want to, like, how you do the job application,
how you go about it?
Service or
yes, the service, yes.
Oh, okay. So what we normally do is, okay, so what we normally have like a 2 weeks collection period of time, because last year we experienced so much clients that the clients became more than what we could handle. So we can't do that anymore. So we've decided to adjust it now this year. So we have a 2 weeks collection period. We have different batches. So we just stopped collecting on Saturday for batch B. Our batch C collection is going to resume from 26th of January. Okay. So what we do is that we collect applications. We have a specific number we collect during our batch. Our next batch will be collecting just for 40 applicants, and the batch D will be 30 applicants. So within a month, we only accept 70 applications. So we help you to do an application. Once you've subscribed to our application package, we help you to do your applications to both to the NHS Trust and both to care homes, just to support, because at times it might be difficult to get from NHS. Getting from care home can be helpful, and which you can switch over when you get to the UK. So we help you to do that applications. So once we have done that for you, we do application like that's 40 applications for 20K. That's 20,000 naira. So we do 40 applications for you for 20,000 naira. So if you want us to do more than that, you indicate and you pay more for us to do that applications for you. That means we'll take it within a longer period. But we try to ensure that when we are doing your application, we are doing it based on the person's specification and the job description. So we'll give you a form. You send a message to our email, because the instruction is on our flyer. So you send a message to our email. We give you a form for you to fill. So once you have filled the form, right, even if you see a place we ask you for your person specification in the form, it doesn't mean that's what we'll use for all the jobs. No. When it's time for the job, we look at the information you have given us. We look at the job description on the job and tailor it and use it to create a good supporting information for you and use that for your applications. The moment you've done the application, in as much as we do the application for you, it doesn't mean that we are the one that will grant the interview. It's still the hospital but that will grant the interview, but we do our best to ensure that we use what they want, because they have a tool, a WhatsApp tool. Sorry, not WhatsApp, sorry, they have a tool that they use in selecting the people that they want. So once they use that tool, they just randomly select the kind of person and they present them for interview. So we try to ensure that because we understand it, so we try to use it to ensure that we give you a good application. So at times, even if you don't get a job, it might not be that you don't have a good application. It might be that there are too many people that were qualified, and that's why they have to select different people. You understand? So we do that, and we help you do your applications. Once you are ready for interview, we do an interview preparation for you, and then hopefully, you pass that interview and you land in your destination. So that's it. All right. Thank you very much.
Me, Daddy. Tell Daddy that.
Thanks everybody for today. Thank you. And I'll be saying bye-bye. Don't forget to always, once you've done your interview, share your testimonies and let us know on the group your questions. Thank you again, everyone. Bye-bye.